In explaining Ghana's COVID testing protocols, the head of virology at the Noguchi Memorial Institute for Medical Research, Professor William Ampofo, said the protocols used by the center guarantees the highest safety standards.
When these samples arrive at the lab, whether it is Kumasi or Noguchi or the VSD or the Public Health Reference Lab, we go through a process to enable us to utilize the reagents or the chemicals in a very efficient manner. We simply pool the samples. What is pooling? Pooling just means that if you have 1,000 samples, you put them in pools of 10, and therefore you test at a time 100 pools. So in a short time, instead of testing only 1,000 samples, you actually test 10,000 samples. This simple arithmetic is what some people cannot do.
Professor Ampofo also indicated that though individuals have been tested multiple times, it does not significantly affect the overall national data count of tests churned out.
The number of samples is approximately equal to the number of tests that are reported. There has been some discussion about the retesting for the recoveries. Recoveries we have right now is 120 people. If those people have been tested 4 times, that's 480 samples or 480 tests. So the retests are insignificant compared to the total number of tests that we've done. And actually, we have a separate database for those who have been retested. So when we provide the cumulative figures to the Ghana Health Service, it excludes those who have been retested. So I think this point should be made clear that the retesting does not affect the data that is reported.
Speaking on post-COVID, Professor William Ampofo revealed that government is putting together a policy document that will address the matter of inadequate funding for research institutions in the country.
We are research institutions. So before the outbreak, we had supplies available. And in fact, one major effort is to replace those resources that we have used for the testing. And therefore, that question about the policy is something that is strongly being considered, both by the Ministry of Science and Technology, also by the Ministry of Health and by the Ministry of Education. And the policy is being put forward so that these research institutions get an annual budget line to enable us provide, quality work towards medical science and public health in Ghana.
Giving updates on Ghana's COVID-19 case management, the Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje, said there have been 120 recoveries so far out of Ghana's 1,154 cases.
Categorized into general surveillance, travelers, enhanced surveillance, and then the total. Under the general surveillance, as at the 20th of April, which we're reporting, we have 401 cases that are reported positive. We still have the 115 travelers who were quarantined and tested at 115. Through the enhanced contact tracing, in the last 3 weeks, we have about 638 positives, bringing the number to 1,154 cases as at today. Out of this, we have had about 120 of them having recovered, a change from the 99 in the last reporting.
The media was advised not to churn out inaccurate information that threatens the fight against the disease. Information Minister Kojo Ponkruma said expert advice must be sought for clarity on complex issues.
In trying to get data to help us solve this problem, that one is not fair to them. It is fair to ask questions, and we'll do our best to get them to answer the questions. But what is not fair is to impugn ill motive and intellectual dishonesty to these experts, these doctors and professors who are breaking their backs around the clock to do this work for us. I think what we should be doing instead is to be encouraging them and supporting them, and not to be throwing their work out of the window.
To prevent misinforming the public, government has advised all media houses to engage the services of experts in COVID-19 discussions on their network. My name is Kojo Ajman, reporting for Citi News.